Imagine a city the size of New York being wiped out. That's the impact of cholera, claiming an estimated 120,000 lives each year, a number that is as chilling as the disease itself. This isn't just a statistic, it's a stark reminder of the power that a single bacteria, Vibrio cholerae, can wield when it finds its way into the human body. The name cholera might sound like an ancient term, a relic of a past era when medical science was still in its infancy. But make no mistake, cholera is very much a contemporary issue, a deadly foe that continues to lurk in the shadows of society, especially in regions where clean water and sanitation are hard to come by. So what exactly is cholera? It's an acute diarrheal disease that can kill within hours if left untreated. It's caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. The symptoms can be mild to severe, and they usually start 2 to 3 days after exposure. Severe cases involve rapid heart rate, loss of skin elasticity, dry mucous membranes, low blood pressure, and rapid weight loss. And here's the terrifying part. Cholera spreads quickly. It can spread like wildfire in areas with poor sanitation and inadequate clean water, turning a small outbreak into a full-blown epidemic in a matter of days. But it's not all doom and gloom. While cholera is deadly, it is also preventable and treatable. With early detection and treatment, the mortality rate can be less than 1%. The challenge, however, is reaching those in need in time, especially in remote or impoverished areas where healthcare facilities are scarce. Now journey with us as we delve into the story of a cholera outbreak, because understanding the past is key to shaping a future where no one has to fear the wrath of this deadly disease. In 2010, a devastating earthquake shook Haiti, but what followed was an even more horrifying disaster. The earthquake, with a magnitude of 7 on the Richter scale, brought about calamitous destruction. Buildings crumbled, roads were torn apart, and over 200,000 lives were lost. The disaster left the country in ruins, and its people in a state of shock and despair. But the worst was yet to come. In the aftermath of the earthquake, an enemy, invisible to the naked eye, started to creep in. Amid the rubble and chaos, cholera began its deadly assault. Within 2 weeks of the earthquake, the first cases of cholera were reported. The bacteria, thriving in the unsanitary conditions left by the earthquake, began to multiply at an alarming rate. Cholera is a waterborne disease, spreading through contaminated water and food. The earthquake had damaged the country's infrastructure, causing a severe shortage of clean water. People were forced to drink and use contaminated water, and the bacteria found an easy route into their bodies. The conditions that led to the outbreak were a perfect storm of devastation. The country's healthcare system was already frail and under-resourced, and the earthquake further crippled its ability to respond. The lack of clean water and sanitation, coupled with overcrowded living conditions in temporary shelters, created an environment ripe for the rapid spread of the disease. The initial impact was catastrophic. The disease, known for its swift and severe symptoms, spread like wildfire. Within a few days, hospitals and makeshift clinics were overwhelmed with patients. The symptoms of cholera, severe diarrhea, vomiting, and dehydration, are rapid and can be fatal if not treated promptly. The death toll began to rise, adding to the already grim post-earthquake scenario. The outbreak of cholera in Haiti was one of the largest in recent history, with over 600,000 people infected and more than 7,000 lives claimed by the disease in the first year alone. The outbreak was a stark reminder of the destructive power of cholera, particularly in areas with poor sanitation and inadequate access to clean water. The disease hit the most vulnerable the hardest: children and the elderly, those already weakened by the earthquake, and those living in the most impoverished areas of the country. The outbreak exposed the deep-rooted social and economic inequalities in Haiti, and the dire consequences of these disparities in the face of a public health crisis. The cholera outbreak in Haiti was not just a public health disaster, but also a stark reminder of the interconnectedness of our world. It highlighted the urgency of improving sanitation and access to clean water, not just in Haiti, but globally. A single disaster can trigger a chain of events that can lead to an outbreak, and the repercussions can be felt far and wide. But how did this happen, and how was it controlled? Tune in for the next segment as we delve into the cause and spread of cholera and the response to the outbreak. Cholera, an enemy unseen, silently spread through contaminated water and food. This stealthy assailant, known as Vibrio cholerae, is a bacterium that thrives in aquatic environments. When it finds its way into our bodies, usually through the consumption of contaminated water or food, it begins its destructive path. Picture this: a single drop of water, seemingly harmless, but tainted with the bacterium. As it enters the body, it travels to the intestines where it begins to multiply, releasing toxins that attack the body's cells. These toxins disrupt the normal flow of sodium and chloride, triggering severe watery diarrhea. Now, you might think, diarrhea? That doesn't sound so deadly. But here's the thing. With cholera, the diarrhea is so severe that it can lead to extreme dehydration in just a matter of hours. And without immediate medical intervention, this can be fatal. But why is cholera so deadly? It's because it's a master of stealth and speed. The symptoms can start as early as 2 hours after exposure and can rapidly escalate within a day. And by the time the symptoms become severe, the body is already critically dehydrated. Furthermore, the bacterium is incredibly hardy. It can survive in water for long periods, and it only takes a small amount to cause infection. This is why cholera spreads so quickly in areas with poor sanitation, where water sources can easily become contaminated. And let's not forget about the human factor. People unknowingly carrying the bacteria can also spread the disease, especially in crowded conditions where hygiene practices are compromised. Cholera's impact on the body is devastating, and its ability to spread so rapidly makes it a formidable enemy. But it's not just the physical toll it takes. The disease also leaves a profound impact on communities, causing panic, disrupting lives, and straining healthcare resources. The situation seemed hopeless, but then came the fight back. The world rallied. Aid workers, doctors, and scientists joined hands to fight the invisible enemy. In the face of the cholera outbreak, the response was swift and coordinated. On a global scale, international organizations like the World Health Organization and the Red Cross sprang into action. They mobilized teams of doctors, nurses, and aid workers to provide medical treatment to the sick and to help prevent the spread of the disease. These health professionals worked tirelessly in challenging conditions, often risking their own lives to save others. They set up cholera treatment centers, where they administered rehydration solutions to replace the fluids and salts lost through severe diarrhea. This simple but effective treatment saved countless lives. Alongside medical treatment, efforts were made to improve sanitation and hygiene. These are crucial in preventing the spread of cholera, which is caused by the ingestion of water or food contaminated with the Vibrio cholerae bacteria. In areas hit hard by the outbreak, aid workers helped to establish clean water sources and to promote good hygiene practices, such as hand washing with soap. But the response wasn't just about immediate relief. It was also about finding a long-term solution to cholera. And for that, we needed research. Scientists from around the world came together to better understand this deadly disease. They studied its causes, its spread, and its effects on the human body. They developed rapid diagnostic tests to detect the presence of the cholera bacteria, enabling quicker and more accurate diagnosis. And they made significant advancements in cholera vaccines, which offer the prospect of longer-term protection against the disease. At a local level, governments, communities, and individuals also played a crucial role in the response. They supported the work of international organizations, providing resources and manpower. They helped to raise awareness about cholera, educating people about the symptoms, the risks, and the importance of seeking medical help at the first sign of illness. And they showed remarkable resilience in the face of adversity. Despite the fear and the uncertainty, they continued to fight, to hope, and to care for one another. They proved that even in the darkest times, the human spirit can shine bright. The response to the cholera outbreak was a testament to the power of collective action. It showed that when we come together, we can overcome even the most formidable of challenges. But it also highlighted the need for continued vigilance. Cholera is a disease of inequity, disproportionately affecting the poorest and most vulnerable. To truly defeat it, we must address the underlying issues of poverty, lack of access to clean water, and inadequate sanitation. The battle against cholera was intense, but slowly, hope started to emerge. As we move forward, let's not forget the lessons learned from this outbreak. Let's continue to fight, to research, to educate, and to care, because together we can make a difference. The fight was tough, but the human spirit triumphed. Cholera was finally under control. The victory against cholera wasn't won overnight. It was a result of tireless efforts by many: doctors, nurses, scientists, governments, and everyday people who took steps to protect themselves and their communities. It took a colossal amount of work to bend the curve of the outbreak. In-depth research was conducted to understand the bacterium's behavior, which led to the development of effective treatments and preventive measures. Health organizations worldwide initiated mass vaccination campaigns, and governments implemented stringent sanitation measures. Public awareness was ramped up, people were educated about the importance of clean water and how simple hygiene practices could make a huge difference. Gradually, the number of cholera cases started to decrease. What was once a terrifying disease became manageable. The decrease in cases was a testament to our collective efforts and the power of human resilience. It was a moment of triumph, a victory of human spirit over a deadly adversary. However, this victory was more than just a decline in numbers. It was a lesson in the power of collective action. The fight against cholera taught us that when we come together, we can overcome even the most formidable challenges. It reminded us of the importance of cleanliness, of access to clean water, and of the crucial role that education plays in disease prevention. The battle against cholera also highlighted the importance of preparedness. It showed us that we must always be ready to face such challenges, that we must invest in our health infrastructure, in research and development, and in educating our people. Despite the victory, we must not forget that the war is not over. Cholera is still a threat in many parts of the world, and we must continue our efforts to eradicate it completely. The lessons we learned from this outbreak must guide us in our ongoing fight. We must remember that every small step counts, every effort matters, and together we can conquer anything. The victory was sweet, but the war against cholera continues. Knowledge is power, and in the fight against cholera, it's our strongest weapon. When it comes to battling this menacing disease, we must understand that awareness is a key component. It's not simply about knowing what cholera is or how it spreads, but about comprehending the severity of the situation, the impact it can have on communities, and the role each of us can play in preventing its spread. Cholera has been a public health concern for centuries, but the good news is that it's preventable and treatable. The first step in prevention is education. We need to ensure that everyone, everywhere, understands the risks associated with cholera and the measures they can take to protect themselves and their communities. This involves understanding the importance of clean water, good sanitation, and proper hygiene practices. But spreading awareness isn't just about sharing facts. It's about creating a supportive environment where people feel empowered to make positive changes. It's about encouraging communities to take ownership of their health and to rally together in the face of adversity. So how can you help? First, you can start by educating yourself and those around you. Learn about cholera, its causes, and its symptoms. Understand the importance of clean water and sanitation and how to practice good hygiene. Second, you can support organizations that are working tirelessly to combat cholera. These groups are on the ground providing medical care, distributing clean water, and building sanitation facilities. They are making a real difference, and they need our support. Finally, you can use your voice. Advocate for improved water and sanitation services in your community. Demand that your leaders prioritize health and hygiene. And most importantly, share this message. The battle against cholera is not one we can win alone. It requires a collective effort, a global response. It requires each of us to do our part. Share this video, spread the word, and together we can make a difference in the fight against cholera.